I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today is there was a study that was out, and the study showed that 70.6% of the people that got COVID said they wore masks, in this one group that they interviewed, wore masks all the time for at least 14 days before getting the COVID. So, of course, the controversy came up. The masks work, the masks not work. I don't know. I wear a mask when I'm out in public. When I'm home, I don't. When I'm on the air, I don't, which is nice. They don't make us wear masks at the studios. But there are so many other things that you should be doing anyway, not just for COVID, but for your health. And so the first half of the show, we talked about zinc and how important that is, and I kind of went down a rabbit hole with that. But if you're just tuning in, this show is going to be on my website, drjoe.com. Also, I want you to make sure you follow us on Facebook and Instagram because we live stream these shows. In fact, we're live streaming this show right now. And we always store these shows on Facebook. So you follow us at Dr. Joe Esposito, the @ DRJOE Esposito, ESPOSITO. And by the way, you need to follow us. I give you guys a lot of good information. I answer your questions without hesitating whatsoever on the website, on the shows. But I need you to do me a favor. If you like what you're hearing, I want you to follow us on, especially Instagram, but Facebook and Instagram. Because the more followers we have, the more attention we're going to get from these big social media groups, and the more we can get this word out. So I'm asking you as a favor, but I'm also telling you you have to do it at Dr. Joe Esposito. It'll take you literally a second to do, and I appreciate it. So, all right, so let's keep talking more about things that you should be doing every single day. Before we went to the break, we talked about vitamin D. Folks, if you're not taking vitamin D, shame on you. I don't think anyone should not be taking vitamin D in the winter months. So vitamin D, I take 5,000 international units, 5 drops of Dr. Joe's vitamin D, and that's on the website, drjoe.com. We talked about zinc. Dr. Joe's Essential Source has the daily dose of zinc in it. Then if you're eating a good diet as well, you're getting around 15 to 30 milligrams a day, and that should be enough for most people. Vitamin C is important. If you're not eating a lot of fruits and vegetables, which a lot of people aren't, and you're eating a lot of alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, chances are you're going to be vitamin C deficient as well, and you're more likely to get infections. So vitamin C is important. I do recommend you take vitamin C, the whole vitamin C, not ascorbic acid. The reason is ascorbic acid oftentimes is made with genetically modified corn, which I'm not a fan of genetically modified foods. And also there are some studies, there's some controversy here, but I always err on the side of caution. Some studies say it doesn't work as well because it's only 1/8 of the vitamin C molecule. Somebody sent me an email one time and said, what are the other 7/8? Hydrogen, carbon, I mean, it's just molecules. It's the way the molecule is formed. So vitamin C, I think, is really important. You get that from fruits and vegetables. And again, Essential Source is going to give you the vitamin C that you need. But as long as you're eating a good diet of fruits and vegetables, nuts and seeds, fruits and vegetables mainly, you're going to get your vitamin C. If you do start to get under the weather, you can take a gram of vitamin C every hour. In a couple of hours, you'll get loose stools. Then you got to cut back. You took too much. But what we're doing is really super saturating your body with vitamin C. I also take something called glutathione. At the break, somebody asked me, what's my protocol? My personal protocol, Super Greens and Essential Source, vitamin D, glutathione. Glutathione is the master antioxidant. It's the big one. And that's the one that helps the liver function more efficiently and fight off free radicals and helps the immune system. We also have Dr. Joe's Seasonal Tonic and Dr. Joe's Wellness Booster, which should be back in stock because we run out of it so quickly. Wellness Booster is Echinacea, pau d'arco, olive leaf extract, and suma root. These herbs have been shown to stimulate the function of white blood cells. I take a dropper full of that every day. And it has a little bit of alcohol in it. So if you are an alcoholic, you have trouble with alcohol, I don't recommend you take this. But alcohol, it does have an alcohol base, but boy, is it potent, and I just love it. If I do feel under the weather, I said I suck on a zinc lozenger. I'll boost my vitamin D and vitamin C. And I also take something called Dr. Joe's Seasonal Tonic. Now, the seasonal tonic is ginger, horseradish, cayenne pepper, onion, and garlic, and we puree that in an apple cider vinegar. It tastes the way it sounds. It is strong. However, It works really well. A lot of flight attendants, pilots, people that travel a lot, they carry this stuff. It's little bottles, in dropper bottles. They carry it everywhere they go. They'll stock up if they're going on a long trip because they know that if they take a few dropperfuls every half hour even, they'll feel a whole lot better. So there's a ton of proactive things that you can do to keep yourself healthy regardless of COVID. And I think you should be taking these steps always. In the winter, I'm always being proactive about my immune system. I try to avoid sugar. I try to make sure I keep my body in motion. I take hot showers, raise my body temperature. I have a steam shower at home. I take a steam shower. So I'm constantly proactive in the winter because I don't want to get sick. In all the years I've been in practice, 37 years in practice, I've missed a half a day of work in 37 years. And the reason I missed that half a day is I hit my head. I was at the office and I hit my head really hard and I was dizzy. And my staff, I couldn't walk. And my staff said, you need to go home. You can't be seeing patients. And no, I'm fine. But they did send me home. So in 37 years, missing a half a day isn't too bad. And so just do what I do. That's what I'd suggest. Other things, you got to get the zinc. But here's the other thing with supplements, you got to make sure they're absorbed. And it turns out something called quercetin really helps there. Zinc alone is incapable of fully stopping viral replication as it cannot easily enter into the fatty cell wall. So if you take something like hydroxychloroquine, that's a drug that opens up the cell wall. But getting into the cell is critical, and there's something called quercetin. So quercetin is able to open up the cell walls and get the zinc in. And the nice part is we put quercetin in Dr. Joe's Essential Source. So it's there. You can also do something called EGCG, which is green tea. You can drink green tea, and you probably should. Organic green tea is a really good choice. And the EGCG can also help you utilize that zinc more effectively. So oftentimes in healthcare, we think about a one and done. All right, well, zinc helps with viruses. I'm going to take zinc. Well, that's great. But if you don't have quercetin, it's not going to work. I can take hydroxychloroquine from a medical standpoint, but if you don't have the zinc to get the zinc binds to the virus in the cell, hydroxychloroquine isn't going to work. So that's why we talk about the synergistic effect of healthcare. Nothing stands alone in healthcare. Nothing works independently. And so with chiropractic care, we can adjust you, put the bones back in place, and that takes the pressure off the nerves, and the brain sends messages along the nerves to the organs, and now the brain and the organs are talking to each other. If you have a pinched nerve, there's inflammation. Inflammation can become systemic. It can go through the whole body. It can get into the brain. So with chiropractic care, along with nutrition, we can help reduce inflammation. So you see how everything starts to tie together? So in our offices, we do, of course, chiropractic. We also do nutrition. We work on a digestive system. If you have acid reflux, heartburn, burping, gas, bloating, many times we need to adjust or pull the stomach down away from the diaphragm. Just the other day, I felt fat. Now, I eat really well. I felt fat. And I said, why am I feeling fat? Started thinking about what I'm eating. I'm eating really well. And I realized as soon as I feel that way, I was burping a lot. I said, I got to get my stomach adjusted. So I grabbed Dr. Irwin, and all my doctors are trained to do this. Dr. Irwin took my stomach, pulled it away from the diaphragm, helped a little bit, went back to him the next day, pulled it down. I was fine. My stomach flattened out. I had more energy. Burping went away. So many times that sore throat that you may be experiencing could be acid reflux. So we can do zinc and selenium, and we can do, the quercetin and super greens and essential source, and all that's great, but you got to make sure you tune up the car as well as putting good gas in it. Think of your body as a car. So that's why everything works synergistically. Now we have a medical division. So we can do hormone therapies. We can test your hormone levels, and many times we may recommend supplements. We may recommend hormone replacement therapies. So there's a lot of things that we offer. Pain management. There are some cases that come to us, and all my team's an expert in pain management. We're really good at getting people out of pain. But sometimes there's so much inflammation. Sometimes the bone is so damaged, the joint is so damaged, we have to go in there and give you an injection. It's called, pain management. So we may have to do a steroid injection. We may have to do a cortisone injection to get in there, which is the same thing, to bring down the swelling. Now, once we do that, many times we can do better manipulation. So many people have had chiropractic care. They're not getting results they want. We add a medical component. Or maybe we have to give you medication, maybe anti-inflammatories. Bring that inflammation down so the adjustment works better. We also offer something called PRP. Now, this is my prediction. I've never been wrong in my predictions. This will be the next movement in healthcare. We take blood out of your body, spin down the platelets, that's the first P, platelet-rich plasma it's called. We take out the platelets, and those are the growth factors, and we re-inject them back into your body. So for knee arthritis, shoulder arthritis, hand arthritis, trigger finger, PRP works wonders. In most cases, not every case, but in most cases. And way, way, way less expensive than even things like stem cells or surgery. So PRP is definitely moving to the forefront because it's very effective and very inexpensive, just like chiropractic, just like nutrition. But PRP can be used for even hair growth. Now, if you're totally bald, it's not going to work. But if you have a bald spot, PRP has shown wonderful results. Erectile dysfunction, wonderful results. Women and sexual dysfunction, leaky bladder, amazing results in most cases. So we can do PRP for a multitude of different things, and we have that available as well. So in our offices, I'm trying to make it a one-stop wellness center where you can get most of your healthcare problems addressed in one place for a lot less expensive than what other forms like surgery would be. So we've had a lot of people, and there's a lot of research on PRP that have slowed down or prevented people from needing surgery. So again, if you want to make an appointment, drjoe.com, drjoe.com.
You were mentioning vitamin C, and all I could think is all of the advertisements I keep getting for IV therapy.
Yes.
So what's your opinion of IV therapy, especially in regards to vitamin C or even vitamin D?
Yeah.
Is it safe?
Yeah, it's very safe. What IV therapy is, what Garrett's talking about, is you can mix up these cocktails, they call it, and you can mix up these cocktails of supplements, and instead of taking it orally, you can inject it directly into the blood. Now, if you're going to have that done, you want to make sure you know somebody, if you have somebody who knows what they're doing. Because you don't want to mess up, because some things have to go through the digestive system. Some things can be put directly into the blood. And so the IV therapies work really well. But again, you can contact us if you want more information. But yeah, you want to make sure it's being done by somebody who's an expert in that field. You don't want to go to some back alley IV company. And sometimes people use it as a joke. Oh, I have a hangover. I had this IV bag and I feel great. Yeah, but many times those people don't know what they're doing. They're trying to do it kind of be hip and cool, but you really got to know this is a health procedure, a medical procedure, because you're doing IV, and you want to make sure it's done by a professional. So, all right, good question, though. All right, so earlier I made a reference to something called melatonin. Now, melatonin is produced by your pineal gland. It's located in the center of your brain, and that hormone is critical to help regulate your sleep cycle. And many times when people can't sleep, it's a melatonin issue. So melatonin is important as an energy hormone and a potent antioxidant, and appears to play a role in even cancer prevention. So what we used to think years ago, melatonin only helped you sleep, it turns out it does a ton of other things, as most things in the body. It's very rare that something just has one purpose in your body. It usually does multiple things. So melatonin can protect what's called your mitochondria. The mitochondria is the part of your cell that produces energy. And so if the mitochondria is damaged, you may get fatigue. Now, mitochondria is important not just because you're tired, but it makes the muscles work. So not just your biceps and your triceps, your heart. If the mitochondria in the heart isn't working, it can affect how the heart beats, how the blood flows through your blood vessels, how your colon expels waste products and absorb nutrients, your sex organs. So it's really important, blood vessels, it's really important that the mitochondria work properly. And it turns out that melatonin is protecting the mitochondria. So you see, the research is so cool when you look into this stuff, and I just get so excited. And melatonin works synergistically with vitamin D. So this is why it's so important to get the vitamin D. It also works with glutathione. We talked about glutathione. That's one of the supplements I take every single day. Multiple sclerosis, cancer, neuropsychotic disorders, high blood pressure. These are all examples of diseases that appear strongly linked and to be affected by your vitamin D and your melatonin status. Now, a lot of folks have MS. I have patients with MS call me all the time. Dr. Joe, I have MS. There's nothing that can be done from what I'm being told. Number one, no dairy products. Ever, under any circumstances, no dairy products. You got to cut out dairy products. No artificial sweetener. How often? None. Never. Not ever. Artificial sweetener can aggravate MS. Dairy products can aggravate MS. Got to check your vitamin D levels. Make sure it's normal. The melatonin has to be working properly. I'm going to talk about how to make sure you get enough melatonin in your body. You can take it as a supplement, but again, I'd rather have your body produce its own. So melatonin works as a natural sleep agent. Its biological effects, like I said, go way beyond that. The immune system, it boosts your immune system in a variety of ways. Cardiovascular, gastrointestinal. So one study, researchers suggested melatonin may even improve the treatment of bacterial diseases such as tuberculosis. In another, melatonin was identified as a potential tool against inflammation and autoimmune diseases, including type 1 diabetes, which is an autoimmune disease. Melatonin is also linked to energy hormones. We talked about that. So melatonin is really, really, really important to make sure you have the proper amounts. And many of us aren't getting the proper amounts. So what do? Optimize your melatonin production. You do that by getting plenty of bright sunlight during the day. So if you're in an office and you don't have direct sunlight, I recommend you get a full spectrum light bulb. They're everywhere. Full spectrum light bulbs are going to give you all the colors of the rainbow, and that full spectrum is going to help stimulate your body during the day. If most people avoid bright sunlight because it might be irritating or it might be burning their skin. I have a friend of mine, and he lives in Dominican, and he said, Dr. Joe, I want to go visit my mother in Dominican. I want to bring her some vitamin D as a supplement because you talk about how important it is. So I told him, I said, listen, your mother lives in Dominican. She's right near the equator. Chances are she doesn't need vitamin D. And he said, oh, no, you don't understand. We don't go out in the sun. He says, we park a car in a garage. He says, we cover our heads. We wear umbrellas. He says, we very seldom go out in the sun because it's so hot. I never thought about that. So I told him, and she's dark-skinned, I said, make sure you get your mother's vitamin D levels checked to see where she is, but I gave him some vitamin D to take with him to bring to his mom. So most of us are not out in the sun for 10, 15, 20 minutes several times a week. So that's why the vitamin D is so important. But optimize your melatonin production. And again, you can fix that by getting full spectrum lights in your office. It's no big deal. Optimize your melatonin production. You got to get to plenty of sunlight, and that sets what's called your circadian rhythm. The circadian clock is you should be awake and you should be asleep. Blue light from electronic devices and LED light bulbs are particularly problematic and inhibits melatonin the most. So how many of you look at a screen every day? Of course you do. Your phone, your computers, televisions. So if you need lighting, opt for incandescent light bulbs, again, full spectrum, candles, and even salt lamps, which is really cool. These salt lamps that kind of glow that yellow orangey thing, those don't seem to have the effect. You can get blue light blocking glasses. If you're on a computer a lot, get some blue blocking glasses. A very dear friend of mine, she wears them a lot, and it helps tremendously. So you might want to consider these things as well, and that's going to help your body be awake during the day and then sleep at night. And that's the key with the melatonin. So there's a lot of research on melatonin out, and it's also now a standard treatment adjunct for COVID-19. It means it's not the only treatment, it's one of them. Recent research suggests melatonin may be important as an adjunct to COVID-19 therapy. Patients hospitalized with COVID-19 pneumonia were giving very high doses. Here's the key. You're probably not going to do this at home. It was very high doses. As an adjunct therapy, the standard care, and they improved within 4 or 5 days, and all of them survived. Now, again, this is a melatonin supplement. Melatonin inhibits what's called the cytokine storm, which is associated with the COVID infection. The cytokine storm, we talked about this when it first came out on our show. Your body sends in the first wave of good cells, white blood cells, and they help fight off the disease. Well, many times those white blood cells are overwhelmed. So then the body sends in a second wave of troops. And this second wave of troops are not as specific as the first wave. So they'll attack the viruses in the lungs, but they also end up attacking the lungs themselves. And so I think one study I read, and again, studies are changing day to day with COVID, 50% of people that are dying of COVID are dying from the cytokine storm. It's the immune system attacking themselves. So what we're finding now, melatonin can help regulate or mediate the cytokine storm. That's what we talked about earlier on, vitamin D, vitamin C. You want to do everything you can to help modulate, if you would, that cytokine storm so your body doesn't attack itself. That's like, yeah, it's great to send in these warriors, but they may not be the best trained warriors. They're kind of killing the good guys and the bad guys. So melatonin also regulates and improves the risk of severe COVID-19 for other things like high blood pressure, insulin resistance, and diabetes. And we talked about that earlier, how important it is that it works on so many different levels. So melatonin, again, you can produce your own. But here's the thing. The way the body produces melatonin is your stomach breaks down proteins. And your stomach breaks down proteins and breaks them into amino acids. The amino acid tryptophan, as we said, becomes serotonin. Serotonin becomes melatonin. Melatonin now is helping everything from the immune system to the cardiovascular system. So you need that melatonin. And so a lot of people, when they have acid reflux or heartburn, can't sleep very well. And when they can't sleep very well, that's going to affect the immune system as well. So everything in health is so tied together when I was teaching the other day, a group of doctors at a state convention, and I was the guest speaker, one of the guest speakers, and one of the doctors even said, Dr. Joe, my staff and I, my team, people who work in the hospital, we listen to your show regularly. You're like, we listen to your show and then discuss it for hours. They said, it seems like it's so complicated. It really isn't. Break it down. Normally functioning nervous system, normally functioning digestive system, good nutrition. That's the game. Chronic heartburn prescriptions can cause diabetes. That's another thing that's in the news, and it kind of ties into this because so many people are taking proton pump inhibitors, 24% increased risk of developing type 2 diabetes if you're taking these. So again, if you're shutting down your acid, your protons, which are the acids, you're not breaking down the proteins into amino acids. So in many cases, we can fix that, not always, but many, by adjusting or pulling the stomach down away from the diaphragm. So in our office, we check the nervous system because the nervous system controls everything. We check the digestive system. If you have acid reflux, heartburn, diarrhea, constipation, bloating, in many cases, there's a physical component, excuse me, getting excited, not just a chemical component. So many times we have to get in there and fix the physical component by manipulating or adjusting the spine or the stomach or the foot or the knee. And then you got to get the diet right. You got to make sure you're eating mostly fruits, vegetables, nuts, and seeds. You're staying away from the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. It's the holidays, folks, and everybody's going to be bringing in junk, breads and cookies and donuts and cakes and pies, and please, I'm begging you, don't eat them. One supplement I do recommend if you have a lot of sugar cravings is called Gymnema, Gymnema. It's not on the website, but we have it at our offices. And one of my very dear friends, she was having trouble with sugar, so I got her on some Gymnema, and she said the other day, she goes, I don't crave sugar at all anymore. And I said, that's great. And then she said, I bet you it's the Gymnema. I said, yeah, there it is. And you could also chew a Gymnema tablet, and then before you eat something sweet, and it'll have no sweet flavor. So it numbs your taste buds if you need it in an emergency, so you don't want to eat sweet foods. But that's going to blow out the immune system. And that's why I'm scared, because the immune system, we here in the States eat, everywhere around the world eats a lot of junk, but we here in the States eat mostly junk food in many cases, and I'm really afraid. So supplement-wise, again, somebody asked me on social media, what's my protocol? Super Green's an essential source, glutathione, vitamin D, adrenal support I take every single day. I take omega-3 fatty acids for brain function. I got to make sure my brain is working the best it can. One of the doctors at this conference the other day where I was the speaker, she goes, you seem to be around for a long time, and she guessed I was like 22 years younger than I am. I went, ha, 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 beautiful. So we have the tools in many cases to help get you well. Chiropractic care, medical intervention, pain management, injections for spine and pain management, PRP, which brings down inflammation. It's your own cells from your own body that we can take out and re-inject in a concentrated form for arthritis, for hair growth, for erectile dysfunction. And again, it doesn't help in every case, but in most cases, we see a majority of results are off the chart, like 85%. So my approach is always, let's take the conservative approach first. Then we can build from there. If you've ever been in a car accident, ever, if the car was damaged, you were damaged. So minimum would be chiropractic care and nutrition. Maybe we have to go in and do some medical intervention. Maybe we need to put some PRP in there because you tore some ligaments. You may not know you have these injuries. That's why you got to come to us so we can evaluate, or somebody who's qualified, if not us, somebody who's qualified to evaluate your spine. So the supplements we talked about, all of them are on the website, drjoe.com. The Super Greens, the essential source, the vitamin D, the B complex, the glutathione, Super Wellness Booster Seasonal Tonic, they're all on the website, drjoe.com. You can pick them up at our offices, save shipping. I am more than happy to save you guys money if I can. So you can go to the website, drjoe.com, or come by our offices and pick them up. If you want to make an appointment to come see us, do it. Normally, the first chiropractic visit is $375. That's an exam, x-rays, consultation, first adjustment, and then the next visit going over the x-rays and a complete nutrition evaluation. We've reduced that through COVID to $149. We do accept insurance for future care for that. Most insurance companies, auto accidents, again, workers' comp injuries. We have cash plans available. All the supplements are on the website. We want to be your doctor. And also, I need you to do one more thing. Follow us on Facebook and Instagram at Dr. Joe Esposito, at DrJoeEsposito. I'm Dr. Joe Esposito, the website, drjoe.com. Catch you next time.
Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.